You already good on white? Gosh, you guys are way, way, way ahead of me. Turning off my phone. Yes. That way for the people watching on streaming, are you about my height?
Well, I don't know, you have big heels.
I do have big heels on. I'm just making sure. That's a good height for you. Okay. Okay. And we're streaming? Okay. Welcome. We are at the OU College of Allied Health, so glad you're with us today. We're excited to share information on a research project that involves children in Oklahoma with autism and their parents. This OU research evaluates a parent-focused approach on autism, and we have with us today the lead researcher, Renee Damon. She is also director of the Oklahoma Autism Network at the Tolbert Center for Developmental Disabilities and Autism at the OU College of Allied Health. And Renee is right here to my left, and Renee is going to be speaking. We have a family with us today, mom and son who participated in this research project, and they're going to be speaking a little bit as well. Renee will introduce them momentarily, and with that I'm going to have Renee come to the podium. She's going to talk a little bit about how this research came about. She'll talk about what the research entailed. She's going to talk a little bit about the results and what their recommendations to the legislature will be based on those results. So with that, I'm going to turn the microphone over to Renee Damon.
Thank you, Teresa. The research project we conducted came about in 2009 from an interim study that happened. There was a Senate bill that passed, Senate Bill 135, that included multiple components, and one of those components was looking at the effects of using applied behavior analysis in a consultative model and working with parents to look at the changes in child outcomes. As a result of that, what we designed is the Connected Kids program. And the Connected Kids program is a program that works specifically with parents, so it's partnering with parents to learn skills to help expand their child's social communication skills, because we know social communication skills are one of the core deficit areas for children with autism. What was different about this program, often traditional therapy models focus on the professional working directly with the child. And what we did with this program is we went into the homes, worked with families in their natural environment, and as I said, partnered with the parents. So the focus during the time we were in the home was on working with the parent, for the parent to learn skills to help their child learn to expand their communication skills, expand their play skills and their imitation skills, for the purpose of the family then being able to carry out those skills during all times of the day, during regular daily routines, during play. And what we found through this is a change for parents. Parents learned from the beginning of the study to the end to utilize these strategies with their child in the context of daily routines and play. And we also saw a change in children. The children had statistically significant change in their social communication skills and in other developmental areas as well, in addition to their engagement with their parent. We also had qualitative measures where we conducted family interviews to get the parents' perception of their experience and the impact on their family. And one of the additional exciting things for us was that parents expressed the change in not only the relationship of the parent or caregiver with their child for the people who participated, but also the positive change in the relationships with other family members. Families also expressed what a difference it made because they were able to take what they had learned and go out and do things that they couldn't do before. Do the things that other families take for granted, like going out to eat, going to church, just going to the park. So we worked with families in their home over a period of 12 to 14 weeks with a 6-month follow-up and found these changes for the families that participated. And what our next steps are, we had a report that we submitted to the governor and the legislature and the Department of Human Services, who was the funding agency for this project. And our recommendations that we've included in that report are looking at how we can take the Connected Kids program and expand availability to other children across the state. The program is a natural fit with our state's early intervention program because it does take place in the home and the focus is on partnering with families. And we've also made recommendations looking at feasibility of implementation of the program within early childhood settings. where we can work with teachers, and then teachers can then partner with parents to work with parents to carry the strategies over into their home. Looking at how we can take this to children who have, parents who have older children over the age of 6, which the children we worked with were between 2 and 6.5 in the study. And then also looking at funding and how we can expand funding and the availability of professionals in our state, including board-certified behavior analysts who can provide this intervention to families, not just in the Oklahoma City area, but in all areas of the state. I'd like to just introduce Angie and her son, Paxton. He's gone missing. He'll come back. For Angie to share a little bit of her experience in the program. Spelled for you? It's Renee, R-E-N-E, Damon, D-A-M-A-N. Sure.
My name is Angie, A-N-G-I-E.
Lift the microphone. You're nice and tall.
Yes. Last name is Nolte, N-O-L-T-E -Jarvis, J-A-R-V-I-S. And for me and my family with Paxton, it was such a struggle. About from 18 months on there, he just stopped talking. He didn't want to be near us. No eye contact, no physical emotion. So it was rough as a mother to know that your son didn't want to hug you, couldn't say mom, no kissing. All the stuff that you saw other parents do with their kids. So it was really hard wondering what you were doing wrong with your kid. I felt guilty that it's because maybe I worked all the time. I was working full time to try to support us. And it wasn't until that we finally got into some speech therapy, and then luckily from there we found out that maybe he might be autistic, and we got him diagnosed here. And it was soon after that that we found the Connected Kids program. It was immediately after, and it was such a lifesaver for us. It's like having a whole new kid. It wasn't long into the program that I got to hear my son say mom for the first time. And that still, when I think about it, it is hard to think about that, that a lot of people take that for granted, that he can say mom over and over 100 times a day, and I don't care. I'm just happy he's talking. When we first started, and it's hard to think back to those days now, when I watch videos that they recorded of him not playing with me, I'm sitting there getting blocks, trying to get him to want to play, build things, play with cars, and it's like I'm not even in the room. I'm not his mother. And now it's nonstop, mommy, come play, all the time now. The eye contact is amazing now. He looks at everybody. He'll follow your finger. He's just your typical kid. And I hear over and over that from families that tell me they would even, when listening to him talk and interact with their kids, they would never even know he was autistic, which is so great for us because we went through a struggle at times when we would be at the park and other families would see him and kind of hear him nonverbal and struggle for the words, and he'd want to go to other kids, and they would pull their kids away and not want him to play, thinking something was wrong, which is hard to see that, other parents don't want their kids to play with yours, but now he's the life of the party. He's my little social bug now, talking all the time. I mean, just in this short amount of time, he went from basically being nonverbal to now in senses, which we didn't think he was ever going to get to that point. And the fact that he's my little cuddle monster, which, from going from never wanting to be touched. And there you are. You want to come say hi?
Hi.
Hey, you say hi?
Hi.
You tell him your name?
My name's Paxton.
Yeah, your name's Paxton? So, yeah, you tell him. For me, it did teach me how to interact with him. I didn't realize how many questions I was asking him constantly. What do you want? What colors? And constantly asking him questions. And I never thought about it from his perspective, what an overload it was. And so teaching him to mimic me and doing some of this stuff, it's okay. So just some of the models that, that they would show us with, are you singing? He does love to sing. It's not touched. Please. You see the camera? That would have never happened before, yeah. He didn't want to be held. He wouldn't have waved at anybody. His eyes would be down all the time. We couldn't go to the store because he would have such a meltdown with all the overload of the sounds and the sights and everything. But through the course, we learned to kind of recognize when those meltdowns were going to be able to happen. We knew when the sensory overload, when to maybe expect them and what to do. So it was just nice to be able to learn how to interact with my child that I didn't know how to interact before. And most parents take for granted they don't have to learn how to interact with their child. It's something that does come natural. Oh, you can't see? Microphone? You want to hold some paper?
Okay.
Can you say thank you?
Thank you.
Yeah. You gonna read? Yeah. Yeah, so like I...
Wait.
Definitely. I mean, I've talked to so many other parents that I know that have it, and at times I feel bad that they didn't get to experience the same thing. And I know he's in school right now a couple hours a day, and we've talked to the teachers and therapists, and they are so interested in this program. They looked at the workbook, they used the same stuff in school with him, and they're using it with other kids because they're just so impressed by him and how far he's progressed in school, that they're just so amazed that they want to use this technique. So it's a lifesaver for a lot of families. And I think if you can just teach the parent, these steps, that's all it takes. They're the ones that are going to be with you. They're the ones that are going to respond. They're going to respond to the parent probably more than a complete stranger. So it's just getting that knowledge out there to everybody. Yeah. Yeah. You say thank you?
Thank you.
Yes, your name is Paxton.
So, Renee, this is kind of a shift in paradigm because to me, a lot of the therapy that we see involving children with autism is a therapist working with a child. Mm-hmm. In this instance, you come in the home, and I know even my photographer was a little surprised and thought the therapist was the mom.
Which is good.
You were watching, and the mom was doing a lot of the interactions. So
Right.
Can you talk a little bit about that shift?
Well, as I said, when we were asked to do this, we were asked to look at the effects of applied behavior analysis in a consultative model. So we knew we were talking about something that's, not expecting the child to go see a professional or work with a professional 15, 20 hours a week. And as Angie said, it makes the most sense based on the experience. Our staff has had a lot of experience working with families, over the years who have children with different developmental disabilities. And parents are the ones who spend the most time with their child. They're the one who's there for that lifelong journey. They're the one that's there day in and day out. And so it only makes sense that as opposed to the professional working directly with the child, we work with the parent so the parent feels equipped to have the strategies to support their child in daily life.
So tell me what we're seeing here. This is something that wouldn't have happened at the start of this research.
No.
So Renee, talk to me about so what kinds of things did the program allow? Are you listening to his prompts?
The first half of the program is really focusing on strategies that help increase that child's interest in engaging with the parent. One of the other things that's different, we talked about the difference where it's not the professional working directly with the child, but focusing on partnering with the parent, and through that working to expand the child's skills. One of the other differences is there are some ABA programs that are very adult-directed, where you're trying to get the child to comply with what the adult wants them to do. The whole first half of the time we're working with the parent, it's focused on teaching strategies like following the child's lead, really building on that child's interests and the child's strengths as a way to increase the child's interest in engaging with the parent. And then once you have that child's interest and you're using toys that the child wants to play with, toys that the child has in the home, we don't take toys into the home and then take them out at the end of the visit. We use whatever the family has available. Once you do that, you see that that child increases their interest in engaging. And once you have that increased interest, then you can use those opportunities to expand the child's skills, where you can then use prompting and reinforcement to have the child use a word, or if the child isn't able to verbalize like Paxton is, he wasn't talking and was getting very frustrated and upset, like Angie said, because he didn't have the words. And then his words just came along quickly. For some of the children, because autism is a spectrum disorder, some of the children don't acquire the words, but then we're using other things like pictures or signs or a voice output device to help the child communicate. But you have to get that child's interest. The child needs to be interested in engaging. And then once you have that, you can build from there.
I'm going to reference a scenario that they're going to see on the video. The little boy on the video was involved in an activity at the kitchen table. I don't know if you remember that.
I do.
There was French fries, and then there was an activity. And so through that, it was like we do the activity, and then I get the French fries. So obviously he liked French fries a lot.
He did, and different children are reinforced by different things. You know, as much as possible, we try to use natural reinforcers. So, you know, for example, if the child's wanting to color, you know, we're going to maybe ask that they request, once we get to the latter part of the program, we might expect that the child use a word or something to request the crayon or to request the color. But for some children, you may need to use other reinforcers. And like for that little boy, what was motivating to him were French fries. And his mom, it was snack time. And so she had figured out that for him, that was a motivator. And so she wanted to use that as a reinforcer. And so it was a tabletop activity, playing at the table with some very, you know, structured activities. So she was using that as a motivator for him to complete the task. Often the play that we do with the families happens in all different places around the house. We help the families set up a structured play area, and they usually do that either in the child's room or in another play area of the house. So part of the play may be happening at a table, but I also want to make sure it's clear that it's happening on the floor, it's happening in the living room, it's happening in the child's bedroom, it's happening during bath time, meal time. So the parents learn to use the strategies in all different contexts of their day.
One of the things I was struck by in this research that is of interest to me is the numbers are climbing.
Absolutely.
Recently reported we have more children than previously thought.
1 in 68 now, right.
So my question is, can this model be something that is taught and then replicated so that hopefully more children and more parents could be trained to work with their children, you would see more results?
Yes, and that's our goal. Our goal is to look at how we can partner and train other professionals like early intervention providers so that they know how to use the program, so that the families they work with through early intervention, they can be working with the parents. And then the benefit of that, not always, but sometimes when one child is diagnosed, you see another child in the family that's diagnosed, and we have several families we worked with who had more than one child who was diagnosed with autism. The benefit of that is then the parent has the strategies they know, and they use the strategies not just with the child who participated in the program, but they use it with their other child as well. So you're just getting a compounding effect.
You also have quantitative results, and then you have qualitative results. What's interesting to me is on the parent survey, the qualitative survey, it was so tremendously positive in terms of the responses from the parents to all of the questions with regard to the program. Did that surprise you at all? I mean, usually as a researcher, you probably expect to see it spread out a little more.
Well, I mean, it was a pleasant surprise. I don't know that it was a complete surprise, just because we worked so closely with the families that I think we had a pretty good feel of what their thoughts were. But it was a pleasant surprise to see that they overwhelmingly agreed or strongly agreed to all aspects of the program being a benefit for their child and their family. But I think it also just speaks to the fact that we were going to the home. We worked really hard to fit what they were learning into the context of their daily routines and activities, so families didn't feel like, oh, I just got home from work, I need to carve out an hour and a half to sit here and do therapy. I mean, that wasn't the intent, and that wasn't how it worked. It was learning how to fit. Is there a routine in your day? You can add 5 extra minutes, or you can do this. So what would happen over a period of time is just that cumulative effect where parents would tell us at the end, it's just how I interact with my child now. It just became a natural part of our interactions so that it's happening all the time.